It's normal to feel scared or anxious after a breast cancer diagnosis, but it might help to know treatments have made big strides over the years. Some treatments are local, honing in on a specific area with radiation or surgery. Other treatments are systemic, meaning they destroy cancer cells throughout the body. Think chemotherapy, targeted therapies, and hormone therapy. Today you have a lot of options. Let's start with surgery. While it might sound like a drastic measure, it's actually common for early stages of breast cancer. And it's also more likely to be curative during this time. Here are the 6 main types. In early stage breast cancer, it's important to know if the cancer is spreading beyond the tumor. A sentinel lymph node biopsy can determine this by extracting and testing a small sample of lymph nodes for breast cancer cells. If the biopsy finds the cancer is spread, the next step is likely to remove nodes in your armpit, since that's one of the first places cancer spreads. This is called axillary lymph node dissection. A lumpectomy is when part of the cancerous tumor and some surrounding tissue is removed. It's known as the breast conserving surgery. If your doctor finds remaining cancer in the nearby tissue after your lumpectomy, they'll likely schedule a re-excision. It's a common outpatient procedure. Removing the entire breast is called a mastectomy. And if both breasts are removed, it's a bilateral or double mastectomy. And while breast reconstruction surgery isn't technically a part of cancer treatment, it's an important part of the process and can play a big role in emotional recovery. Very often, radiation and chemotherapy are used in combination with surgery. External beam radiation is one of the most common radiation therapies. The whole process takes about a month and a half, and it's normally broken into 5 weekly sessions. You'll either sit or lie down as the high-intensity X-ray beam scatters radiation through the tumor. It's a fast and painless procedure that damages the cancer cell's DNA, effectively killing it. External beam radiation is common after a lumpectomy to clear out any remaining cancer cells, or after a mastectomy when the tumor is larger than 5 centimeters or if cancer has spread. With chemotherapy, a systematic treatment of drugs kills the cancer cells and stops them from growing. Some chemotherapy drugs are pills, some are injections, and others are infusions, meaning they're delivered into your veins. The length and dosage can vary, but it's common for treatment to last about 6 months, with chemotherapy delivered every 3 weeks. It's most often used after surgery in early-stage breast cancer, before surgery to help shrink tumors, and when surgery is no longer an option, like in advanced breast cancer. The very good news is that as treatment options rise, so do your chances of a good outcome. And with help from your doctor, you can develop a plan that's best for you.